The broadcast is now starting. All attendees are in listen-only mode.
Hi there, this is Wendy White. I'm the industry manager for food and beverage for the Georgia Manufacturing Extension Partnership, which is housed inside of Georgia Tech. And it's my great pleasure to introduce my colleague, Jenny Houlroyd. She earned her Joint Masters of Science in Public Health in Epidemiology and Environmental and Occupational Health from the Rowland School of Public Health at Emory University. She also has a Bachelor's of Science in Public Health from the Richard Stockton College of New Jersey. She served as Occupational Health Group Manager for the Safety, Health, and Environmental Services Office with the Enterprise Innovation Institute at Georgia Tech. As a certified industrial hygienist with Georgia Tech's SHES Group, she assists small businesses throughout Georgia to ensure that their workplaces are free from hazards as possible and that their workers are protected from potential health threats. She's had extensive experience in public speaking in both the occupational and academic setting, serving as faculty for the Georgia Tech's OTI Education Center, Georgia Tech School of Biology, and for the Professional Masters in Occupational Safety and Health program. Prior to joining Georgia Tech, she worked with local governmental agencies, federal agencies, and corporate businesses. In 2019, she enrolled as a student in the School of Public Health at UGA to pursue her doctorate in public health policy. So Jenny, I'll go ahead and turn it over to you.
Thank you, Wendy. Now let me just get this shared. Let's see here. All right, share my screen. Are we able to see my screen yet?
Not yet.
Okay.
There we go.
Okay. All right, are we seeing the right screen now?
Yes.
Okay, great. Welcome everyone. And I am happy to be talking to everyone who's out there and everyone who will be watching this hopefully in the future as needed, to really have this conversation with you on whether to mask or not to mask and how you're going to really deal with this issue when it comes to it being an occupational health setting. So to get started, I really want to dive into this concept of what are your options right now. And when you look at what the new CDC guidelines are, there's really three main options that employers have. You can either waive the mask requirement for anyone who's fully vaccinated, or you can retain the mask requirement completely. Everyone still has to be masked. Or you can just say, no more masks. We're going to do away with masking totally. And what I encourage all employers that I work with on a one-on-one basis is to recognize that this is not really a binary or tertiary decision to make, but it should be much more nuanced than what is really being provided to most individuals. Some of the things that you need to be considering is if you are saying only people who are fully vaccinated can take off the masks, then you have to start addressing issues of who is vaccinated and how do you obtain that information to find out whether or not they're vaccinated. And so that is a key central discussion that you're going to have with your company about what kind of proof is going to be required, necessary, documented, related to vaccination. And if you decide to maintain masking for everybody, even if you are vaccinated, you should be additionally looking at pushback from employees, challenges that may be faced related to that, and whether or not it's necessary given the certain types of working environments. So if you're working outside or if you're working very well spaced out, is it really necessary at this point to continue to retain the masking requirement? And then that third option is eliminating the mask requirement altogether. really should be taken in consideration of the work environment, how well socially distanced the work environment is, how well ventilated the building is, and really pay attention that there still is a risk that remains. So all of this is going to come down to this concept of a risk analysis. So I encourage, and I'm going to give you a little bit more information about this later on, but we do have a free on-site compliance assistance consultation program with Georgia Tech, through Georgia Tech, where we can meet with companies either in person or virtually and go through this triaging with them. And whenever I meet with a company, there's a couple of questions that we start going through one by one. And one of the first things we do is we pull up the infection rates in the region where the company is located. And this can be really challenging, especially if you have a national company. So a company that goes across the entire nations with locations in different regions. And you may have one region where there are little to no COVID infections at this point in time. And there may be another location where there are still consistently higher infection rates. And so I encourage employers to not just make an overall statement that everybody gets to have one decision one way or another, but to really take into account what is the real risk in the location where your employees are working. We also take time to look up local ordinances. And I strongly encourage, when it comes to health-related issues, if you look at the Constitution, a lot of that is delegated to the states and then further delegated to local ordinances. And so you have to be very cautious if there are any state or local ordinances that state one way or another that you are still masking or that the mask requirement has been lifted. And in this situation, if a local ordinance says you have to mask and the federal government says you don't have to anymore, in this situation, the local ordinance would supersede that unless there were court cases to document otherwise. Then we think about the type of industry that it is. And with the OSHA National Emphasis Program related to COVID-19, OSHA has highlighted a specific subset of industries outside of healthcare that are at increased risk for transmission of COVID infection among employees. And so if you happen to be on that highlighted list, and I'm going to share that in a few slides, I strongly encourage you to take that into consideration when you start making decisions about whether to require masks or whether to not require masks. The next question is the ventilation. And really, when I think about risk, when it comes to something like COVID-19, my two concerns are time exposed and ventilation. So if you are outside and you are moving and you're not standing in any one location for any period of time, the risk is going to be extremely, extremely low. But if you are in a poorly ventilated indoor location where you're going to be standing next to people for long periods of time, your risk goes way up. So the ventilation in the room where you're going to have the employees work is going to be essential to filtering out any of the bad stuff that might be in the air. And this is good to consider, not just for COVID, but to consider for air contaminants, to consider for other infectious disease. Ventilation is key to healthy bodies and healthy minds. So you really want to look at what have you done for the ventilation lately. And then we're going to look at the vaccination rate among the workforce. So I know that there's been a lot of talk in the news about herd immunity, and herd immunity can work in different ways, especially if you have what's considered herd immunity among the workforce. So if the majority of the workforce happens to be vaccinated, the likelihood that somebody who may be carrying COVID could bring it into the workforce and then spread it widely will go down dramatically. So if you have a very high vaccination rate among your workforce, the risk of exposure goes down dramatically. And then also looking at what other hazards employees experience. One of the concerns that I've had the entire time is making sure that we don't miss other hazards like lead exposure and cadmium exposure or solvents, and that we don't conflate the two issues and look at masking as a source of protection from other things as well, or we replace actual respiratory protection with masks, cloth-based coverings, and we find that employees are now potentially having greater risk at other contaminants in the workforce. So those are some of the first questions that you really want to be going through with your team and coming up with answers to these questions. And then the next thing you want to be asking yourself is, first and foremost, if you haven't done it yet, you have to do it now, is to create an infection control plan that addresses not only the current pandemic, but how you're going to approach any control measures towards any future strains of COVID-19 virus or any potential new outbreaks. It's a scary thing to consider, but this is just a indicator of what could potentially happen again. And so the best way to prepare for that is to have a document in place on how you're going to manage infection control. This is something that is required through the OSHA National Emphasis Program. And so it is something that we, through the OSHA Consultation Program, and I'll show you where you can look up a sample written program on our website, but that is the first and foremost thing that you need to be doing. The next thing, and this is especially important if you're going to change the requirements, is you want to be performing a hazard assessment for each class of jobs. And this is like the basic foundation principle of safety and health. When you have a hazard assessment that needs to be done, you're looking at it holistically to see how you can improve ventilation, how you can implement engineering controls, how you can administratively reduce the hazard, and how you can include personal protective equipment to further reduce the hazard. And this is the model that's been presented by both the Centers for Disease Control and from OSHA as the way that they want you to look at reduction of control hazards. Because let's be honest, cloth face coverings are not 100% effective. Just like standing 6 feet apart is not 100% effective. None of these items are 100% effective. What you're doing is with each additional item that you implement, you further reduce exposure. So in essence, what you're trying to examine is, given all of the factors that you have going on in your facility, infection rates in the community, vaccination rates at your plant, can you now say with certainty that the risk has been reduced and you can comfortably remove that additional requirement of having a mask? That's where just making bold statements of saying we're going to mask or not mask can be perceived by employees as not being grounded in a thoughtful process, or by outsiders, and that it's more of a political statement, whereas what we really want to be doing is looking at it from a safety and health perspective of saying, is the hazard gone, and is it reduced to a point where it's okay to remove the masks? The next part is, have you received feedback? By far and large, what I am seeing more than anything else is that employers are making decisions without including employees in this hazard assessment process. They're not receiving feedback from employees. They're just making a decision out based off of, we're just going to move to follow CDC guidance, and this is what we're going to do. And it's suddenly causing tension and fear among the workforce because it's not being clearly communicated with them why it's being done. That why is so critical. If I could say to you, you are in this county in southern Georgia, the infection rate is 1 out of every 100,000 people in the county. Under these conditions, it is no longer necessary. And you can spell that out for your employees. It bodes much better than just saying, we're not going to do it anymore. That's not what we're going to do. So really including employees in the process. And that's important not only because it's the right thing to do, but it's also clearly outlined that it has to be done that way through the OSHA COVID-19 National Emphasis Program, which was developed based off of all the experiences that they've had over the past year. And one of the things that they've experienced more than anything else is OSHA complaints related to the conditions in any particular facility. And one of the biggest limiting factors is that there was a lack of communication between what was being implemented at the corporate level and what's actually happening down on the ground where the employees are working. The next thing you want to be asking is, are you complying with the OSHA COVID-19 National Emphasis Program? And are you also complying with applicable existing OSHA regulations related to COVID-19? So there's a lot of regulations, and I'll go through them later on in the presentation, that whether there's an outbreak or not, they still need to be complied with, and they help reduce the risk of COVID-19. And we want to make sure that we are, more than anything else, doing what's the most basic and essential items that need to be done. So to dive into the first question, what is your vaccination status? And this can be a really challenging question, and it's very heated. Believe me, I have dabbled in reading what's out there on the internet and on social media about how passionate people are about vaccination status. So first, let's talk about what does it mean to be fully vaccinated. To be fully vaccinated, you have to be 2 weeks out from your second dose of any of the 2-dose series. So that's if you're Pfizer or Moderna vaccines. And if you've had the Johnson & Johnson one, you have to be 2 weeks out from that vaccine as well. So 2 weeks post your second dose. So you're not vaccinated right after you've had your second dose. You have to wait 2 more weeks before you're considered fully vaccinated. That said, if you have certain medical conditions or are taking certain medications that affect your immune system or your immune system's ability to turn on the way the vaccines are intended to function, you may not be fully protected if you're fully vaccinated. And what I mean by that is these vaccines function in a mechanism where they are training the immune system to react. But if you are countering that with other medication or other health conditions that are telling your immune system to do something totally different, you may end up finding out that you may not have the full protection that a otherwise healthy individual may have. Now, according to the CDC guidelines, if you've been fully vaccinated, you can resume normal activities that you did prior to the pandemic, and you can resume activities without wearing a mask or staying 6 feet apart. However, I want to clearly state this, that they say this is only in non-healthcare settings. So if you are working within a healthcare arena, the CDC guidelines do not apply, and that has to do with a risk assessment. The risk is greater in healthcare settings. So the next question I get quite often is, can you ask about the vaccination status? And so this is what I have read. And let me start by saying I am not a lawyer. So I always encourage companies, whenever they dabble in things that are, that deal with legal, that if they have a corporate legal person, to bring them in or to consult with a legal team. But I pulled this from the GK Law website. And so some of the considerations are you have to follow the guidance from the Employment Opportunity Commission, the Equal Employment Opportunity Condition. And so their guidance says that it is not a violation of the American Disabilities Act to ask if somebody is vaccinated or to ask for proof of vaccination. However, you should be careful or cautious about inquiring why that person chooses not to get vaccinated, because that could open Pandora's box about underlying medical conditions that require accommodations and that may not be appropriate given certain circumstances for the employer to ask about, and may be related to disability discrimination. So that is something that, again, I strongly encourage. If you decide we're going to let vaccinated people no longer wear a mask, we're going to start gathering information about who is vaccinated, talk to HR, talk to your legal team, and get on the same page about how it's going to be done and how that information is going to be protected. Because the next comment that I want to state is that some states and local areas may have omnibus data privacy laws. And these are laws that broadly govern the collection and disclosure of personal data. The only one at the time of this recording on June 3rd is in California. It is the California Consumer Privacy Act. But there are other states that are in fact examining and potentially publishing laws like this. And this will have a big impact on whether or not you can gather certain information. And so if a data privacy law does apply, that would include the employee's vaccination status would be considered private information under these type or this class of laws. So currently there is not one in the state of Georgia. The other thing that you would want to be cautious of is if there are any separate state data security and data breach laws. And so some states have adopted these sort of security laws that give specific information about how to store and scrutinize personal information. And so this normally means that you have to take certain reasonable steps to protect that data from a data breach. And so some of the questions you would want to be asking, especially if you're a safety and health manager, is, okay, we're collecting vaccination status, but is this an Excel file that everybody can access? And are they going to share this information? How is that going to be protected? So that's another question you want to be asking. Is there a secure area with a encrypted file that can be used to protect people from having that information get out? And there's lots of information about that. Again, this is where you would want to bring in a legal team. And then finally, you want to look for any new and existing employment laws or state laws that may impose requirements about employers seeking information on vaccination status. So these laws would fall into two main categories. The first one being that a pre-existing employment law may happen to apply to vaccination status data collected or retained by states, and consider legislation that restricts private businesses from asking for proof of vaccination. So that's one way that a lot of state governments are handling sort of the dilemma related to this, is by creating laws where they're prohibiting private businesses from asking that information, or public businesses, it depends. And then the other category is that, in particular, Illinois has pending legislation that would prohibit employers from requiring an employee to demonstrate that he or she has received a vaccine. So there's different ways that that could fall out, but just be aware that that is one of the elements that is currently in flux. So you've made your decision about how you're going to manage masking or not masking, or maybe you're still trying to, and decide what you're going to do. So the first thing that we would want to consider is how you have, what strategy did you implement to develop an infectious disease and business continuity plan? And so that would include elements like the risk assessment, which I've briefly discussed, and I'll get into a little bit more detail in a minute. What else, and excuse my dog barking in the background, what else have you done to reduce the risk of employee exposure? What strategies have you implemented to date with respect to each aspect of the plan? Are employees involved? And that is so mission critical. I cannot spell that enough out, because that is one area that OSHA is definitely going to be looking at if they show up to your company. One of the first things they're going to do if they're doing a COVID-19 national emphasis program related inspection is they are going to interview workers and get their input on what's going on. Also consider what kind of community connections can you make within the local health departments, within the local health care community, to assist with the management of and delivery of things like vaccinations or other protective measures. And then what other preventative measures are you taking? And then have you been reviewing and updating this plan as things have changed? And that's one of the most exhausting and challenging aspects, but the most important one is things change with this outbreak and you have to be updating as you go along. So I do want to point out a very important disclaimer. The Centers for Disease Control states that they have issued new guidance related to the recommended precautions for people who are fully vaccinated, and which is applicable to activities outside of healthcare and a few other environments. And OSHA is reviewing the CDC guidance and will update their materials accordingly. So what this basically means is OSHA was not necessarily they put out their OSHA National Emphasis Program, then CDC updated their guidance, and now OSHA has to go back and reassess what was provided. So until those updates are complete, please refer to the CDC guidance for information of measures appropriate to fully protect fully vaccinated workers. So this is the new disclaimer that just has appeared recently at the top of the National Emphasis Program documentation. And I think it's important to be aware of this, that this is kind of you are on the record of knowing that they may or may not change what is included in the NEP. So how do you perform a risk assessment? To perform a risk assessment, what you first need to be considering is how you would rank the risk exposure to COVID-19 for each of the employees. So a very high exposure risk would be considered exposure to high concentrations of known or suspected sources of COVID-19 during medical or laboratory procedures. So you know that you're potentially handling materials, people, that may be contaminated or have contracted COVID-19. A high exposure risk means that you have high potential to known or suspected sources of pandemic COVID-19. And then when you go down to the next level, it's medium exposure risk that requires frequent close contact within 6 feet of exposure to others. And then lower exposure risk is to use caution, and that means you're not having frequent close contact within 6 feet of others. So you really want to be thinking about where your employees fall on this list. And for any given day, it may change. So a couple weeks ago, I went out to do 3 different site visits. And depending on the type of company I was going to and what I was doing would be the driver for what kind of protective measures I would take. One of the days I was working at a poultry processing facility, knowing that they are at higher exposure risk and that they have been a source of outbreaks. And I knew for certain that that particular facility had several COVID-19 exposures documented. I did a hazard assessment before we went out, and I was going to be putting monitoring equipment on these employees. So as a result, I selected that day when I was out there, I was going to wear an N95 filtering face piece respirator to make sure that I was fully protected from any potential exposure. Even though I'm vaccinated, I have personal reasons why I want to make sure I take extra precautions. And so that was the decision-making process. On another day, I was just meeting with an individual where we were discussing programmatic issues. And so I was going to be with very few individuals. I was going to be able to have comfortable distance. And so I selected to wear a cloth face covering. And so there is this element of taking into consideration what you're doing. You know, when I go to do air monitoring or noise monitoring, I have to basically be putting my arms around an individual as I'm putting the pump on their belt area and then wrapping the cord around them and attaching it to their breathing zone. So I am in very close contact with individuals. So in that situation, I am at a much higher exposure risk. I'm also at a higher exposure risk because it's unknown. I do not normally work in that environment, so I am going into a different exposure risk. However, if I am going to be going to the office and I am going to be working and there are not many people within the office, I am aware that the majority of the people in the office are vaccinated. When I'm in my office area, I will most likely be not taking my cloth-based covering off for periods of time because I know that it is going to be at a much lower exposure risk. So as you can see, in any given week, I may be masking or not masking or wearing a respirator depending on what environment I'm going to be going into. So I encourage you to be not thinking of it as a yes or no, but of a it depends on the environment. So this risk assessment really requires an important aspect of collaboration. And taking this into account, employees in the same workplace may have different exposure risks. So it's important to consider that someone who is in an aging population who may have underlying health conditions or other comorbidities may be at increased risk of not only contracting COVID-19, but getting sick from COVID-19 compared to somebody who is younger. So that is something to be considering. Also consider the time and ventilation. There are elements of, if you're only going to be with a person for a few minutes at a time, that exposure risk drops dramatically. But if you're going to be spending long periods of time doing the same task in close proximity to somebody, the risk increases. The same thing goes with ventilation. When we are looking at going back to teaching in the classroom and other aspects, there are some concerns I have just with ventilation and whether or not it's appropriately managed. And then also consider, there's this tug and pull between worker risk and customer risk. And those are two very different things. And OSHA is concerned about the worker risk. And the worker risk is going to be different than the customer risk because the customer comes and goes. So just because you have gone to Publix every day since the pandemic hit and you haven't gotten sick yet, knock on wood, you go there for what, 30 minutes and walk around and you're out and you're not standing in any specific period for any considerable amount of time, your risk is low versus the person who is working at Publix, for lack of a better term. I am not specifically stating anything about Publix's policies, but they will have different risks because they are standing there all day long interacting with customers. So those are two different elements. And when you do this risk assessment, you're going to be taking into consideration the hierarchy of controls. So that's looking at things like engineering controls. What changes can you make to the work environment to reduce that work-related hazard? That includes improving upon the ventilation system. If you haven't, call an HVAC person and have them do a tune-up. Change out those filters, make sure that that's functioning properly. What kind of work practices can you implement? Are there ways to make sure that employees are performing the tasks in a safe and proper way that will reduce the risk of exposure? Are there administrative controls? And these are by looking at, can we schedule things differently so that we're minimizing the amount of workers that are in any given area or the amount of time workers are interacting with individuals? And then what kind of other personal protective equipment can we be administering in that location? So what are the main non-healthcare industries to consider that are considered high risk by OSHA? So OSHA has two tiers, and I'm only including the top tier. there's a second tier of ones that they also think are at hazard, but they're not the top hazard. But OSHA has their list of highest hazard healthcare industries, and then they have a list of non-healthcare industries that they consider to be high risk. And these are including meat processed from carcasses, animal slaughtering, poultry processing, supermarkets, discount department stores, general warehousing, temporary health services, full service restaurants, limited service restaurants, and correctional institutions. So those are the NAICS codes and the class of industry that they consider at the highest risk. So if you are in that category, I would think long and hard before you make dramatic changes to your masking protocols without incorporating some sort of really intensive hazard assessment to see whether or not you've reduced the risk. I also want to point out some things that were highlighted by OSHA. So you'll notice I switched from Georgia Tech slides to OSHA slides. These are things that OSHA says they're very concerned about in presentations I've attended. First is whistleblower protection. Workers are protected from discrimination who request inspections, complain about their exposure, want you to report or record illnesses, and or if they report that they've been retaliated against. And so this is a primary focus area of the COVID-19 National Emphasis Program. And they are looking at this specifically during the opening conference of inspections, where they will be interviewing workers to see whether or not there is the potential or if employers are appropriately handling whistleblower protection. Why am I talking about this in a masking presentation? Because if employees haven't been involved in the process, they haven't received the buy-in, or they've complained about the changes in the masking, which is something I'm seeing a lot in the news, they have the right to say, what kind of assessment have you done to prove that it's okay to step away from the mask? And so that's where that hazard assessment is so critical, because it'll provide the evidence and support about whether or not it is appropriate at the given time to scale back from the protective measures. Another thing I wanted to address briefly is just to give you an idea of where OSHA has been citing COVID-19 related inspections. So the top citations have been related to employees not being provided medical evaluation prior to fit testing employee for the respirator, the fit testing of respirators, that employers have not performed the hazard assessment for personal protective equipment and respiratory protection. So again, the overall hazard assessment should include a PPE hazard assessment, because that's part of the hierarchy of controls. And that is one of the main areas where people are getting cited, not having a written respiratory protection program. So if you're requiring the use of N95s, or things that are classified as respirators, you want to also have some form of a respiratory protection program. And then making sure that there's the appropriate amount of personal protective equipment and respirators. One thing that I've noticed a lot is that sometimes there'll be a disconnect, because there may be a barrier at some point in the process from the people that are supplying the personal protective equipment and respirators and the line employee for knowing who to ask them for. So an employee may call OSHA and complain that they don't have access to PPE or respirators, when in fact the company is providing them, but the missing link was the training to make the employee aware of who to ask for that equipment. So just be aware that you could at the corporate level be doing everything right, but there may be a lack of education, outreach, training that's preventing employees from being fully protected or being aware of how to be protected. The other elements is not having employees trained on PPE or respiratory protection. And then this little caveat to retrain when conditions change. So when you change what kind of gear an employee is wearing, you want to make sure you in fact go back and say, all right, conditions have changed, we're going to do this, and this is why, and this is how you properly wear the new set of personal protective equipment that you've been provided. And then also looking at the proper storage of respirators and personal protective equipment, where to report fatalities within 8 hours if they occur within 30 days of the work-related incident. So that is a COVID-19 fatality that is tied back to the workplace when it's happened 30 days between the exposure, and then any other record-keeping aspects. So here's a little bit of guidance about ventilation. I know I've harped on this a lot, but if I'm in a well-ventilated area, I am going to be much more copacetic with moving away from wearing a filtering face piece respirator or wearing a cloth facial covering. What we do know is that COVID-19 is spread through aerosol transmission, and it matters about the dose. So the amount of COVID-19 that a person is coughing out, breathing out, will depend on how severely ill they are with the illness. So the sicker they are, the more that they're going to be spreading it. So you want to be working with your HVAC professional to consider methods to optimize the heating and ventilation and air conditioning. This is really important, especially now in this spring to summer, because right now we're having enough nice days this spring that you can have the bay doors open and have a lot of fresh outdoor ventilation being brought in, which is great. But we are going to hit a moment when it gets way too hot and everybody closes everything up again and relies only on air conditioning. And that's where you start seeing, even during normal times, like that summer cold come into play. And a lot of that is because of HVAC systems that need to be updated or just have general maintenance conducted on them. So making sure that the HVAC system is fully functional. And also, if you shut it down during the pandemic and you're in the process of restarting your HVAC system, you're checking for things like Legionella and other bacteria and fungi that can grow in an HVAC system during the shutdown period. So bringing in a professional to do work on that. Looking at removing or redirecting personal fans to prevent them from blowing the exhalation from one worker to another. As much as possible, increase fresh air from outside. Outdoor air is important, and when you can, as much as possible, open those windows and bring in fresh air. That is how you're going to really reduce the risk. The other thing is make sure, and I can't tell you how many times I see this with poor design, that the exhaust air is not being pulled directly back into the building, because that's not doing you any good. What you want is fresh, clean outdoor air. You can consider portable HEPA fan or filtration systems to increase the amount of clean air that's being injected into the workplace. Make sure whoever is changing out the filters that they wear an N95 respirator. That's what's currently recommended. Wearing N95 respirator, eye protection, and disposable gloves. I will tell you, so one of the things that we've done is sometimes when we're teaching classes, we'll bring an air monitor into the classroom to show how when you just have a lot of people in a room and there's not enough fresh air being brought into the room, what you'll have is a buildup of carbon dioxide, because that's what we're exhaling. And when you have a buildup of carbon dioxide, you start getting groggy, you start getting kind of tired and sleepy. But if you increase the fresh air, you essentially remove that risk and you're more alert and more awake. So I can tell you, like, even if there wasn't a pandemic, if you improve the ventilation in the workplace, you're going to have healthier, happier workers anyway. And please have employees make sure that the exhaust fans are kept on in the restrooms and fully functional, and that employees report hazards. They don't just, oh, that fan isn't working, so we're going to cover it up with cardboard. I can't tell you how many times I've seen vents that were perceived to not be functioning properly covered with some sort of mock-up, when in fact it's causing complete changes in the entire ventilation by doing that. And the ASHRAE has incredible guidance. If you go to the ASHRAE website, they have lots of resources specifically related to COVID-19. Now, I'm not going to get into too much detail with this, but just be rest assured that the requirements to record COVID-19 as an OSHA-related, work-related illness will continue to be in place for the entirety of this pandemic. So if you remove the masking requirement and it ends up that you have an outbreak of workers that are contracting COVID-19 in your workplace, it will be a recordable event. So if you have questions related to record keeping, please let me know. We'd be more than happy to discuss it with you on a one-on-one basis. They have also given different guidance related to how you determine whether or not it's work-related. This is a very nuanced discussion and something that through our OSHA consultation program, we would be happy to work with you to help you go through the process of determining whether or not it's work-related. And that's something we do during the review of the OSHA 300 logs during our consultation visits. You are required to call OSHA or report if somebody becomes sick. Reportable incidents are employer required to keep OSHA injury records, must still record work-related confirmed cases of COVID-19. So just remember that there is a difference between reportable and recordable. So a reportable incident is if you get sick from COVID and end up in the hospital within 24 hours of that exposure, or you end up dying from COVID-19, and that happens within 30 days of the exposure in the workplace. And I want to conclude my little overview and why this decision is so important on whether you're masking or not masking in the workplace is because the basic founding principle of OSHA is that all workers have a right to a safe and healthy workplace. And all workers also have a right to raise a safety and health concern with their employer or OSHA, to request personal protective equipment, to report a work-related injury or illness, and that includes COVID-19. And they also have the right to receive information and training on the job in their workplace. And so they have received a deluge of whistleblower complaints, almost 3,000 between October 1, 2020 and December 31, 2020. I'll be interested to see how many, once we look at the pandemic in its entirety, how many actual complaints have been received. And so OSHA does have information about anti-retaliation programs. So just be aware that I highly recommend as an employer, as you're changing your programs, as you're scaling down, as you're trying to roll back, that you get all management involved in a leadership commitment and accountability program, that there is some system for listening to and resolving employee safety and health compliance concerns, and that method is documented clearly, that there's a system for receiving and responding to reports of retaliation, that there is some form of anti-retaliation training for employees and managers, and that there is definite program oversight. So there's somebody who is able to ensure that retaliation is not taking place in the workplace. Just be aware, there is a potential for an emergency standard related to COVID-19. It was almost published and then it got sent for more reviews. I am not sure what the exact status of it is or will potentially be. I see something different in the news every day, but do be aware that there is the increased enforcement planned over the coming months. We do have a model pandemic preparedness plan on our website. So if you go to our website, which is OSHA it should say oshainfo.godtech.edu. That's a little mistake. It should say oshainfo.godtech.edu, and then go to the resources and model written templates. You can get to our written program templates. And I am here to answer any questions. I hope this was helpful for you. I know I didn't give you a clear answer of go out and take away those masks, or you have to keep the masks on, but I hope you understand how important going through a scientific process of assessing the risk and making a decision based off of risk for your specific facility is so critically important, and what needs to be done to make sure that we're protecting the employees on the job. So thank you.
Jenny, thank you so much. We have time for a few quick questions. If you do have questions, you're welcome to put it in the chat. And so before we get to those, I had one or two questions for you, Jenny.
Sure.
And this is just my ignorance because my focus tends to be more food safety, so FDA, USDA. Does OSHA or maybe the Georgia Department of Public Health, do they have any kind of programs to review and give input on company risk assessments or COVID-19 protection plans?
I'm not aware of anything through the Department of Public Health. With our Georgia Tech OSHA Consultation program, we would look at your risk assessment plans, but we would definitely do it with the lens of worker safety. That's a great question. I really would want to look to see if there are any other resources. I do know that our manufacturer's extension professional at Georgia Tech are really good at connecting employers with different specific areas within different types of industries with experts in the field.
Okay, so the Georgia Tech SHES group is a good resource to go if you're just looking for like an external opinion, an objective opinion on your plans. Mm-hmm.
Yes, and we review plans. In fact, we typically require an employer to send us their COVID-19 plan before we'll go out on site, because we want to know what you have in protecting your workers, so we know what kind of risk we're inquiring, but what we may potentially be exposed to by going out in the field. So that's how I make the decision whether I'm going to wear a respirator or a cloth facial covering. And most of our staff have master's degrees in public health. So we definitely straddle that public health arena versus and also occupational health.
Gotcha. Thank you so much. So, you know, the more I've been thinking about this topic, you know, kind of thinking back through my past experience, and I remember before I went to college for the first time, I had to get that MMR booster shot. And I remember actually I went to my pediatrician because that's the only doctor I had when I was 18 years old. Do you, and I'm not going to tell you how long ago that was. Do you think that COVID-19 vaccines will become part of this, you know, regimented, required vaccinations for things like universities?
That's a great question, and that's to be seen. I mean, I think there are very much differences in opinions on what can be required and not required, and that is, I know some universities are requiring the COVID-19 vaccine for their for students. I know it's a source of contention between, you know, faculty and students, and, you know, faculty are higher risk and students tend to be those inactive carriers. And that's really beyond the scope of my decision-making process. But I do think we'll see as time goes on, with climate change and with the globalization of our economy, the potential risk for pandemic spread of illness is going to naturally increase. You can get on a plane and go around the world in one day, practically. And that globalization, we're getting food from all over the globe. The risk of us needing to better manage it is going to increase. Whether or not we're going to make required vaccines, I don't know. But without a doubt, you're going to have to manage it better.
Yeah, that's definitely my opinion as well. I do not see any questions in the chat. Do you,
Hey,
Jen,
Wendy?
or yeah.
Wendy? Hey, so there's another box that says questions. So I do have 2 questions in that box. I don't know if you can see that on your control panel. No? Okay.
Yeah, no.
I can read them for
Want to
y'all
go ahead
then.
and perfect.
Yeah. Okay. So we've got one person says, we have plants in California, Indiana, and Georgia. The 7-day case rate in Georgia and Indiana is 51 out of 100K and only 7 out of 100K in California. What is a reasonable threshold of cases per 100K, even for unvaccinated within 6 feet indoors, where we can remove masks altogether?
I actually don't know that exact number off the top of my head. What I do recommend doing is contacting each area's local health department to get recommendations for that, because I do know, given population density and other factors play into that as well. So what the threshold is where I live in Cobb County for the schools to be considered relatively non-pandemic levels is going to be different than what a county in rural Georgia would consider non-pandemic. So my recommendation is to contact the local health department.
Okay, and then the other question was, what is considered an acceptable vaccination rate to reduce risk?
I also will have to double check on that number as well. I don't know that exact number off the top of my head, and they've actually changed it quite a bit over time depending on the effectiveness of the vaccine. So I don't want to go on recording with a specific number and have that wrong. So hopefully maybe I can just put a link to where that number would be with the recording, and that would be a much better long-term answer, because I'm afraid I'm going to say something and then they're going to change the recommendation and it's going to be inaccurate. So I'm sorry, I keep mentioning certain numbers.
Yeah, and we're still learning, about this disease, and I think that that's something that people don't properly appreciate. Even though we call this a flu-like, virus, it's different than influenza. So I think that those vaccinations required to kind of gain that herd immunity, it's going to be different for COVID-19 than it was for measles or mumps or some of the other illnesses that we vaccinate for. So I think that we're still figuring that out.
Yeah, and it's hard too, because if there's low infection rates and moderate vaccination rates, you can kind of have herd immunity at a lower vaccination rate than if there's higher infection rates. So it's challenging, and I know it's really hard when everyone wants clear answers, and a lot of it depends on what's going on. But I will try to get a link to where you could get that information real time.
Okay, that was it for the questions that I saw.
Great, thank you.
Alrighty, well, Jenny, thank you so much. That was such an informative presentation, and I know everybody listening real time and eventually listening to the recordings really appreciates the input. And so if you wanted more information, by all means, reach out to Georgia Tech's She's Group. They have plenty of OSHA specialists and people that really specialize in public health and industrial hygiene that can help you out. And Jenny, again, thank you, everyone, and have a great day.
Thank you.
Thank you.